Major depressive disorder is one of the most common causes of disability in the developed world, with a 17% lifetime prevalence in the United States. At least some of the recent growth in antidepressant use, though, stems from their application for a variety of other conditions, including generalized anxiety disorder, PTSD, OCD, and the list goes on and on. SSRIs and SNRIs are first-line agents for many of these conditions, and they have become some of the most prescribed classes of medications in the United States. So, in essence, they put you in a good mood, they help you relax, they take you to your happy place, you know? Kind of like turning on your favorite sitcom. Hey, whoa, no. We're not doing a laugh track. Guys, what is this, 1992? We're officially in the new golden age of television, people! We're better than that! This sketchy farm episode is going to be insightful and sophisticated and overly meta. First, let's introduce the SSRIs, or selective serotonin reuptake inhibitors. This is an office sitcom, after all, and it just wouldn't work without taking place inside of an office of like a failing, outdated, and soon-to-be obsolete business, like a travel agency. Over at the receptionist desk, notice that we've incorporated SSRI into the name of the company, Express Trips. When a quick internet search is just too much of a hassle, leave it to Express Trips instead. Behind the front desk, they've put up a series of travel posters, and if you look closely and squint a bit, not too close to the screen, that's it. You see it now? They depict the names of SSRIs. Fly out on fluoxetine airlines. Or take Parrot Air and lose yourself, and hopefully find yourself deep in the Amazon. That, of course, is paroxetine. And there's Desert Airline. That could be fun. Of course, that's sertraline. And
citalopram, paroxetine. Fluoxetine, fluoxetine, paroxetine, sertraline, sertraline, fluoxetine, paroxetine, citalopram, sertraline, paroxetine, fluoxetine, paroxetine, citralline, sertraline, citalopram.
finally, a chance to head to the city by the bay, citalopram. Alright, because these are SSRIs, this scene wouldn't be complete without our recurring sketchy symbol for serotonin, the hormone that makes you happy. A smiley face, of course. SSRIs work by inhibiting the serotonin transporter, or SERT, thereby increasing the concentration of serotonin at the synapse. So to show you that these are reuptake inhibitors, it looks like Tim over here has found the drawer where the sticky notes are kept, and he has decided to inhibit their uptake, if you will, for his next office prank. Just wait till you see what Tim has in store for his coworkers this week. Tim! And your sides will be banana splitting when the boss is out at a business conference. Who's his replacement? Hey, Michelle, I got those TPS reports you asked for. On the next episode of The Workplace, only on 5HT TV. Whoa, guys, what did I say about that laugh track? If that happened with this prank.
Kiwi lost it out of the drawer. Maybe the president they will take it.
Just wait till you see what Tim has in store for his coworkers this week. Tim! And your sides will be banana splitting when the boss is out at a business conference. Who's his replacement? Hey, Michelle, I got those TPS reports you asked for. On the next episode of The Workplace, only on 5HT TV. Whoa, guys, what did I say about that laugh track? If that happens again, so help me, I will cancel this series faster than season 1 of Firefly. Okay, next, I want to quickly remind you of the names of the SNRIs, or serotonin norepinephrine reuptake inhibitors. You've got venlafaxine, represented by the fax machine, and duloxetine, embodied by this dual copier scanner. You know, that towering behemoth of outdated technology that does something if you can just figure out which drawer or tray. I'm sorry, but why are these machines always so big? Is Kenny Baker in there running a small that...
venlafaxine, duloxetine. Venlafaxine, duloxetine.
Does something if you can just figure out which drawer or tray. I'm sorry, but why are these machines always so big? Is Kenny Baker in there running a small printing press? I digress. To differentiate the SNRIs from the SSRIs, we've included a north-south compass on this world map above the venlafaxine fax machine and the duloxetine copier scanner. It's our recurring symbol for combined norepinephrine and serotonin reuptake inhibitors. Not only that, it should remind you of the north compass wielded by our norepinephrine scout way back in that sympathetic summer camp sketch. Epinephrine and
North and South SNRIs. Venlafaxine and duloxetine inhibit the presynaptic reuptake. Norepinephrine and
serotonin reuptake inhibitors. Not only that, it should remind you of the north compass wielded by our norepinephrine scout way back in that sympathetic summer camp sketch. As the sketch progresses, we'll introduce the numerous clinical indications for the SSRIs and SNRIs. Oftentimes, SSRIs specifically are the first-line agent to keep in mind. These conditions will be illustrated around those SSRI travel posters on the right. When SSRIs or SNRIs are appropriate as first-line agents, we'll orient them around these outdated SNRI office machines on the left. First, let's discuss depression. At Sketchy, whenever we talk about the treatment of depression, we'll include a symbol like this one, the sad mask to remind you of the negative symptoms associated with major depressive disorder, and the happy mask to emphasize the goal of treatment, which is the remission of all symptoms. On the exam, or when you're in the office, you can recognize the symptoms of depression by using the mnemonic SIG-E CAPS, which includes specific symptoms related to sleep, interest, guilt, energy, concentration, appetite, psychomotor, and suicidal ideation. Both SSRIs and SNRIs are first-line agents used for the treatment of major depressive disorder, or MDD. Acute episodes of MDD can last 6 to 14 months if untreated, and many times they last for years. After their first trial on a new antidepressant, about a third of patients will achieve remission. Once an adequate response is achieved, therapy is continued for a minimum of 6 to 12 months to prevent relapse. SSRIs and SNRIs can even be used as long-term maintenance therapy to prevent future MDD episodes. Under the MASKS logo is the name of the network, 5-HT-TV. Let it remind you of 5-hydroxytryptamine, or 5-HT, which is another name for serotonin. SSRIs and SNRIs treat depression by enhancing serotonergic neurotransmission in the CNS. In fact, all currently available antidepressants exert many of their clinical and toxic effects by increasing the availability of monoamines at the synapse, usually serotonin and norepinephrine. All right, let's illustrate a few more clinical scenarios in which either SSRIs or SNRIs are your first-line agents for treatment. After major depression, anxiety disorders represent the most common application of antidepressants. Many of the SSRIs and SNRIs have been approved for all of the major anxiety disorders, including GAD, panic disorder, PTSD, and OCD. Let's go through them one by one. See Randy over here, a little nervous or anxious, if you will, as he opens up his latest performance report? Let him represent treatment for generalized anxiety disorder, or GAD. Recall from the Ben's Diner sketch, the drugs from the sedative hypnotic class are still occasionally used for the treatment of anxiety disorders. Disorder, or GAD. Recall from the Ben's Diner sketch, the drugs from the sedative hypnotic class are still occasionally used for the treatment of anxiety disorders. Benzodiazepines, for example, provide much more rapid relief of GAD symptoms than any antidepressant. SRIs and SNRIs, however, have been shown to be as or more effective than benzodiazepines for the long-term treatment of anxiety. Not only that, SSRIs and SNRIs do not carry the same risk of dependence and addiction that occur with the benzos. SSRIs and SNRIs, then, are your go-to drugs. The same is true for other anxiety disorders, such as panic disorder. While generalized anxiety disorder involves a chronic state of worry that inhibits daily activities, panic disorder is characterized by recurrent episodes of brief, overwhelming anxiety, which often occur without a triggering factor. Patients often fear having an attack and avoid situations in which they might have an attack. At Sketchy, our recurring symbol for panic disorder is Edvard Munch's masterpiece, The Scream. And in this scene, we've incorporated it into the screen of Randy's computer, kind of like a scream saver. You know, when they pitched this joke, this scream saver joke, they told me to just run with it. And I told them over and over again, I won't be involved in a joke with a laugh track. I mean, it's in my contract. You know, it's tacky, it's passé, it's Seinfeld, you know, and I'm not Costanza. Or just look at David Schwimmer. I mean, that's a whole career ruined. Have you seen him in anything lately? Have you ever heard him try to tell a joke without a laugh track? Because I have. It's not funny. SSRIs and SNRIs are both first-line treatments for post-traumatic stress disorder, or PTSD. This condition manifests when a traumatic event results in recurring intrusive thoughts or imagery, hypervigilance, nightmares, and avoidance of situations that remind the patient of the trauma. At Sketchy, PTSD is symbolized by the PTSD dog tags, like the ones held by Reed over here, the oldest employee at the agency whose enigmatic past slowly comes to light as the season unfolds. SSRIs and SNRIs can benefit a number of the symptoms of PTSD, including anxiety and hypervigilance, though other treatments such as psychotherapy are usually required as well. Obsessive-compulsive disorder, or OCD, is also known to respond to serotonergic antidepressants. OCD is embodied by Dwayne over here, who meticulously arranges objects on his desk. Tim has pulled many a prank on Dwayne over the season, whether his belongings are put in Jell-O or mysteriously end up in the office vending machine. Not today, Tim. Not today. OCD is characterized by obsessions, which are repetitive anxiety-provoking thoughts, or compulsions, which are repetitive behaviors that reduce anxiety. Several of the SSRIs are approved for the treatment of OCD, and that's why Dwayne's desk is situated on the right side of the sketch near that Express Trips logo. For the rest of these clinical scenarios, I want you to think of SSRIs rather than SNRIs. For instance, SSRIs have been shown to be helpful in the treatment of bulimia. Bulimia is characterized by episodic binging on food followed by ritualistic purging either through emesis or laxatives or some other method. At Sketchy, we symbolize bulimia with a binge-sized snack, like what you might find in that snack drawer over at Angelica's desk. I want to emphasize that anorexia is different. This condition involves distorted body image and reduced food intake causing weight loss that is at least 15%. Below ideal body weight. SSRIs are not useful for anorexia, though refeeding, family therapy, and CBT can be used for treatment. Social anxiety disorder is a common condition in which patients experience severe, debilitating anxiety during social interactions, impairing their job performance, for example. Just look at Brian over here, who hasn't answered his office phone in months and really hasn't interacted with anyone during that time. You know, I'm not sure if anyone in the office even remembers that he works here. Don't worry, Brian, because several of the SSRIs have been shown to be effective for the treatment of social anxiety. All right, so it turns out that the SNRIs, but not the SSRIs, are useful for the treatment of certain pain conditions. So, for our last few clinical applications of antidepressants, let's head back over to the venlafaxine fax machine and duloxetine copier scanner. Uh-oh, it looks like someone was up all night secretly putting all of Evan's stuff into the vending machine again. Look at him struggle. That is a classic gag. Drugs that possess both norepinephrine and 5-HT reuptake blocking properties can be useful in treating pain disorders. For example, both duloxetine and venlafaxine can be used to treat diabetic neuropathy, kind of like the peripheral pins and needles he's feeling right now from getting his hand caught in that Dia-Sweeties machine. I want you to look for a frayed wire like this one leading up to the machine whenever we talk about the treatment of neuropathic pain specifically. Though, as he hunches over to retrieve his belongings, keep in mind that duloxetine has been shown to be useful for managing all kinds of chronic pain conditions, including low back pain and osteoarthritis. Duloxetine has all belongings. I want you to look for venlafaxine. Can be used to treat diabetic neuropathy, kind of like the peripheral pins and needles he's feeling right now from getting his hand caught in that diasweeties machine. I want you to look for a frayed wire like this one leading up to the machine whenever we talk about the treatment of neuropathic pain specifically. Though, as he hunches over to retrieve his belongings, keep in mind that duloxetine has been shown to be useful for managing all kinds of chronic pain conditions, including low back pain and osteoarthritis. Duloxetine has also been shown to be effective in the treatment of fibromyalgia, a condition that involves widespread pain in muscles, joints, and soft tissue locations, all in the absence of distinct lab or physical exam findings. Just like the absence of distinct flavor or nutritional value in our recurring symbol for fibromyalgia, fiber bars. When treating your patients with SSRIs or SNRIs, you've got to keep in mind these drugs are not for the management of acute symptoms. See this calendar here hanging in the back? 2 months. And wire like be used to both diabetic neuropathy, kind of like the peripheral pins and needles he's feeling right now from getting his hand caught in that diasweeties machine. I want you to look for a frayed wire like this one leading up to the machine whenever we talk about the treatment of neuropathic pain specifically. Though, as he hunches over to retrieve his belongings, keep in mind that duloxetine has been shown to be useful for managing all kinds of chronic pain conditions, including low back pain and osteoarthritis. Duloxetine has also been shown to be effective in the treatment of fibromyalgia, a condition that involves widespread pain in muscles, joints, and soft tissue locations, all in the absence of distinct lab or physical exam findings. Just like the absence of distinct flavor or nutritional value in our recurring symbol for fibromyalgia, fiber bars. When treating your patients with SSRIs or SNRIs, you've got to keep in mind these drugs are not for the management of acute symptoms. See this calendar here hanging in the back? 2 months. And that's because SSRIs and SNRIs take about 1 to 2 months to achieve their maximum effect. And that can be a really long time when your patient is waiting for symptomatic relief from their chronic pain or anxiety syndrome. Recall that when treating depression, about 1/3 of patients can achieve remission. However, if your patient comes to clinic and continues to describe depressive symptoms, keep in mind that you've got to give that SSRI some time to work. A trial of therapy should last at least 8 to 12 weeks before you can definitively assess an inadequate treatment response, after which therapy can be switched to another agent or augmented with the addition of another drug. Also, let's revisit Randy's anxiety-inducing performance report. Long-term treatment of numerous anxiety disorders are achieved with SSRIs and SNRIs. Remember though, if Andre here needs immediate symptom relief, an SSRI isn't going to cut it. They are for long-term maintenance therapy only. A benzodiazepine, for example, provides much more rapid relief of both generalized anxiety and panic. All right, let's wrap up this episode with a discussion of side effects, starting with the SSRIs. If you take a look behind the Express Travel receptionist desk, it looks like Darren is having a little trouble changing that water cooler. Wait a minute, ADH? Why does that brand of water sound so familiar? Oh yeah, our ADH water hazard sketch. Retaining lots of free water? That, my friend, is an inappropriate amount of ADH. SIADH, that is, a rare side effect of the SSRIs. SSRIs are also associated with diminished sexual function and interest. As a result, at least 30 to 40% of patients report reduced libido, disrupted arousal, anorgasmia, and increased ejaculation latency. It's not good. And it's really not looking good for Patty's ex-boyfriend. Try as he might, he gets rejected by Patty every time with a face full of paper clips. She's got a new man in her life, Leroy. Tim and Patty are so cute together. Tim and Pat forever. I mean, that kiss from season 2? It's like all is right in the world, you know? The SSRIs are also associated with weight gain, hence the rather rotund midsection of Cam's ex. Just look at yourself, Leroy. You gotta get your act together, man. You better check yourself. SSRIs may also cause drowsiness as well, and that's why Patty's receptionist understudy is less than enthused about how these later seasons are turning out and is dozing off. SSRIs can cause insomnia as well, so just remember that your patient may report some daytime sedation and diminished mental energy. Oh, hey, you guys, come here. Michelle is back from that business conference. Because it's the season finale, Tim has set up the prank of the season. No, actually, this is the prank of the series for sure. You know those sticky notes we saw at Tim's desk earlier? Well, take a look. Yeah, even the boss's favorite mug. All those smiley faces in one room, that can only mean one thing. It's our recurring sketchy symbol for serotonin syndrome. Drugs that inhibit serotonin reuptake, such as SSRIs and SNRIs, can potentially lead to excessive levels of synaptic serotonin. This leads to a potentially fatal syndrome that you must immediately recognize on the exam. Serotonin syndrome shares many of the same characteristics as neuroleptic malignant syndrome, or NMS, which is a separate condition that can be precipitated by dopamine-blocking agents such as antipsychotics. There's a subtle distinction, however. Just like in NMS, serotonin syndrome can present with autonomic instability, agitation, hyperthermia, and hypertension. And it looks like Michelle has had it. Agitated, definitely hyperthermic, and that air coming out of his ears is our recurring theme for hypertension. Here's what should clue you into serotonin syndrome specifically. Look for hyperreflexia and clonus. When in NMS, you're more likely to see rigidity and hyporeflexia. Take a look at the boss's left leg. He's tapping his foot impatiently as he waits for someone to admit to the prank. Let it remind you of that bouncing ankle clonus, a classic sign of hyperreflexia that they love to use on the exam. Tim's prank isn't done yet, though. He had a lot of time on his hands. Once the boss steps in there, he's in for quite the surprise. See the tricycle on the floor? Meant to send Michelle headfirst into a face of mousetraps. Yeah, it's a bit excessive, sure, but the tricycle should remind you of tricyclic antidepressants, and the mousetraps? MAO inhibitors, of course. It turns out that serotonin syndrome can occur with overdose of a single drug or concurrent use of multiple drugs that increase CNS serotonergic transmission, such as SSRIs with tricyclics or MAO inhibitors. In future sketches, whenever we discuss an agent that increases serotonin at the synapse, we'll illustrate a dense collection of smiley faces like this one to remind you of that risk for precipitating serotonin syndrome. The management of serotonin syndrome involves discontinuation of all serotonergic agents, stabilizing vital signs, and possibly administration of a serotonin antagonist. That's where cyproheptadine comes in, represented in this sketch by Michelle's reminder that at express trips there are only 3 rules. No rules, just ride. Silly pranks are prohibited. That's cyproheptadine blocking 5-HT2 for all you sketchy listeners at home. And rule number 3, Dwayne, remind me to never come up with office rules while we're at Outback Steakhouse. All right, take a last look at that venlafaxine fax machine before Bradley takes it to a place where obsolete office machinery goes to die. PC load letter? What does that even mean? Sorry. SNRIs have many of the same serotonergic adverse effects associated with the SSRIs. That N in SNRIs, though, means that they increase noradrenergic transmission, so you might see some increased blood pressure and heart rate, as well as CNS activation, including insomnia and agitation. Okay, I think there's just enough time to mention one more thing before we lose that key 18 to 49-year-old demographic. Let's talk withdrawal. Sudden discontinuation of a short half-life SNRI or SSRI, such as paroxetine or sertraline, can lead to what's called a discontinuation syndrome. It involves flu-like symptoms such as dizziness, fatigue, headache, and nausea 1 to 2 days after stopping the medication. It's kind of like Peter here, who's withdrawn himself from work today because of the flu. So remember to taper your patient off that SSRI, otherwise you'll come to realize that they've been missing a lot of work lately. Though I wouldn't say they've been missing it. Oh, I thought for a second that they were gonna... Next week on The Workplace, Randy finally opens up that anxiety-inducing performance report, or does he? SSRIs can take up to 2 months to reach full effect. Does he wait it out, or does he just take a benzo for some immediate relief? Reed's enigmatic past finally comes to light when the office gets a visit from one of his old war buddies. Michelle's dad? Tim moves every object on Dwayne's desk 1 centimeter to the left. Angelica says yes to SSRIs and no to binging. Remember, it's bulimia, not anorexia, that can be treated with SSRIs. Over next to the venlafaxine fax machine and duloxetine copier scanner, Evan proves that neuropathic pain can't stop a man from getting to his TI-83. And sexual dysfunction fills the air when Patty's ex makes a surprise visit. Will they? Won't they? Find out next week only on 5HT TV.